and would like to invite Dilara and Omar to introduce themselves. Just a reminder again that we will take questions following that presentation, but please make sure to put your questions into the chat box. Thank you so much.
So thank you, Wendy. Good afternoon, everybody. My name is Omar Nieto, and I will be presenting findings from our EHE supplement project titled Technology-Based Prep Delivery and Retention Services for Priority Populations in LA County. And I'm just curious, are we able to have the slide deck pulled up for the presentation? If not, I can just continue with them.
I think Dami's saying keep going and she's trying to pull it up.
Got it. So the goal of our project was to assess the feasibility and acceptability of utilizing technology-based PrEP delivery to facilitate greater PrEP uptake, adherence, and persistence among Los Angeles County's priority populations. So we did so by engaging multiple stakeholders in a dialogue about the use of digital technology to improve PrEP delivery. So on February 10th, 2020, UCLA CHIPS, in partnership with DHSP, held an all-day community consultation. So the consultation itself was broken up into morning and afternoon sessions. During the morning session, community stakeholders were introduced to various digital technology products that are available to support PrEP delivery and maintenance. So these included 2 standalone telehealth mobile applications or services, and they were called Nurex and PlushCare, both here on the screen. 2 clinically integrated telehealth services, E2 PrEP and Health Fauna, and one text messaging service called ITAB, which stands for Individualized Texting for Adherence Building. So representatives of each of the services delivered a 15-minute presentation describing their product's features and how it supports clients along, or how it could support clients along the PrEP care continuum. They were also asked to discuss how their technology products might be integrated into existing PrEP programs here in LA County. And then a brief question and answer session followed. So in the afternoon session, multiple concurrent breakout groups were conducted to assess the acceptability and feasibility of using digital PrEP technologies to improve the delivery of PrEP with specific priority populations. So these included Black and Latino cisgender men who have sex with men, Black and Latina transgender women, Black and Latina cisgender women, and then persons who inject drugs. Next slide. So in total, 67 stakeholders attended the community consultation. Participants included senior leadership at agencies, program staff, HIV health educators, outreach and testing specialists, and PrEP navigators, and of course, our digital PrEP representatives. Next slide. So I now want to present results from the breakout groups with our key community stakeholders. So these slides are just going to provide more of a broad overview of the discussions that occurred during the breakout groups. So overall, technology-based PrEP delivery was perceived as an acceptable and beneficial strategy to improve PrEP uptake, adherence, and persistence among LA County's priority populations. So key benefits of the services included their accessibility, their convenience, and useful features like reminders, motivational messages, and in some cases incorporating gamification components to support engagement in PrEP care. Still, participants noted several potential challenges to the use of digital PrEP technology among these populations, such as inconsistent access to technology, specifically for those who might experience barriers to using phone-based services, potential discomfort with the technology, and the cost as another factor that might dissuade clients from engaging with the services. Next slide. So in addition to discussing the perceived benefits and challenges, participants also offered recommendations for tailoring these products to better meet the needs of the population. So this includes customization options to really customize the option to help meet the individual needs of the client, offering online access to PrEP care to support populations that experience barriers to engaging with phone-based services, and also providing incentives for adherence support. Next slide. So from the agency perspective, digital PrEP technology was generally perceived as an acceptable strategy to improve PrEP delivery services. So for example, participants believed that the products could support service delivery by offering useful tools that could link patients to PrEP care. They also believed the products could maximize their resources by helping to facilitate the service provision from any location. So really giving them the opportunity to use this platform or these platforms to conduct virtual visits with patients. And then finally, participants believe the products could improve patient-provider communication. However, they did discuss several feasibility concerns. So these included lack of funds and infrastructure to support the adoption and maintenance of these services at the agency, limited staff capacity to implement these technologies, and potential lack of buy-in or involvement from senior leadership, in part due to this culture of discomfort with adopting a new technology at the agency. Next slide. So while these concerns were noted, they did offer potential strategies for addressing them. So in terms of the cost and infrastructure concern, they suggested financial support from private and public funders to build and maintain the necessary infrastructure to support these types of technologies. In terms of capacity issues, participants noted that representatives of the digital tech companies could help to provide trainings on the products, both for the clients and the staff. And then finally, to address leadership buy-in, participants felt it would be critical to really start to engage senior leadership in the types of discussions that occurred at the consultation. Next slide. So these are some of the recommendations for implementation, but for the sake of time, I do just want to focus on the one recommendation that occurred that's going to really build into Dr. Dilara Uskup's section of the presentation, and that is conducting an implementation research, a possible implementation research science project that builds off of our findings from this initial consultation. So next slide. I do want to note before we hand it over, and Elena, please correct me if I'm wrong, but our report from the consultation, as well as some of the informational resources for the various digital technology products, are available on the UCLA CHIPS website. Is that correct? Awesome. So I'm now going to turn over, I'll now turn over the presentation to Dr. Dilara Uskup, who will discuss our new EHE implementation science project.
Thank you, Omar. Next slide, please. Again, I am Dr. Dilara Uskup, and I am the co-principal investigator of this project, the Teleprep project for Black and Latina cisgender women. Next slide, please. Here you see outlined the goals of our project, which are in twofold. One, to assess the acceptability, adoption, appropriateness, and feasibility of using telemedicine. We'll be using the app PlushCare for PrEP delivery to Black and Latina cisgender women among staff at 2 community-based agencies in Los Angeles who serve Black and Latina cisgender women. Our second goal is to assess the acceptability, adoption, appropriateness, and feasibility of using telehealth for accessing PrEP among Black and Latina cisgender women clients at these 2 agencies. All right, and here we have our collaborators, and we're working with East Los Angeles Women's Center and Black Women for Wellness, and of course, CHIPS. CHIPS you see in the second line is at the center, and we have PlushCare, our other collaborator, as well as the County of Los Angeles Public Health Department, DHSP. We couldn't do this without their support, so we thank all of our collaborators. Next slide. All right, so here you see our Teleprep project timeline. And in January, staff will complete a 2-hour Teleprep information session, training session. And we just completed that on Inauguration Day on the 20th. So we are so excited to have gotten to this point where we have done the training session. And next, we're going to have this introductory meeting with PlushCare staff and the staff at our 2 community-based agencies. We're quickly going to be moving into February and June. February through June, and then we'll, at those 2 points, in that time frame, we'll have 2 primary activities, and that's that staff will conduct teleprep information sessions with approximately 50 women from each agency and refer women to the UCLA team to participate in a qualitative interview. And staff will also complete a client engagement log following each information session, and client information logs will be sent to the UCLA team at the end of each month. In July of this year, staff will participate in a post-implementation interview with our UCLA team, Teleprep team, and in August, we will disseminate the final report and the client engagement log summary to both project sites, as well as make that available once we have our findings neatly wrapped up in a report to share. Next slide, please. All right, and here are, next slide, please. And what you'll be seeing on the next slide is our Teleprep information session objectives, and that's to educate, motivate, and navigate. I just love that. So we're going to be educating Black and Latina cisgender women about PrEP as an HIV prevention strategy and PlushCare as one option for accessing PrEP. Motivate Black and Latina cisgender women to consider PrEP as a potential HIV prevention option and PlushCare as a method for accessing PrEP, and navigate Black and Latina cisgender women to resources to access PrEP by providing them with the PrEP navigation resources sheet. Next slide, please. And just again to clarify that our two sites that we're working with, they'll be delivering this Teleprep information session to Black and Latina cisgender women. And this kind of describes that step. So information sessions will be delivered in a casual conversation, and staff will have conversations with clients on topics of importance to their health. And the information sessions will assess the level of awareness and knowledge about PrEP. And again, this is on behalf of the client, on the side of the client, provide education and fill in knowledge gaps about PrEP, discuss the benefits of PrEP, assess their level of awareness and knowledge of PlushCare, provide education and fill in knowledge gaps about PlushCare, discuss the advantages of using PlushCare to access PrEP, provide PrEP resources, provide a PrEP resources guide, and to assist Black and Latino cisgender women in signing up for PlushCare to access PrEP. And so because we just had this training session, we had a chance to talk to our two agencies, and they had so many creative thoughts about how they were going to incorporate these intervention sessions into the way that their sites already run. And this included reaching out to potential study participants and potential participants of the Teleprep initiative through social media, through doing these kind of Zoom meetings and referrals as appropriate from other staff at the agency. So we are really delighted, and they seem really fired up to get this intervention going. Next slide, please. And as I said earlier, we're going to be using PlushCare to access PrEP, and it's contracted by the California Department of Public Health. And again, because they already had that relationship with the state of California, we're going to be working with them. And I'm being asked to wrap up, so we're just going to quickly go through the next few slides. Next slide, please. All right, and so PlushCare just allows patients to choose their primary care provider, schedule consultation, and get medication delivered to their home. Next slide, please. Here you see our research activities, which is going to be to conduct a post-implementation interview with agency staff, and then to also conduct post-implementation interviews with Black and Latina cisgender women who participated in the information sessions. And the research team will create a project report for dissemination, as I stated earlier, for our stakeholders and federal partners, and that should be available on the CHIPS website. And now we open it up for questions, and our question slide is the next slide. Thank you.
Thank you so much, Dilara. We're actually going to have to hold for questions for this one. We're a little bit short on time. Oh, my camera's off. We're a little bit short on time, but if folks have questions, please put them into the chat box, and we'll make sure that that we can follow up on those and share responses with everybody.
I wanted to share. Sorry, I just wanted to share that we are extending it by 5 minutes.
Okay.
The session 5 minutes past the hard stop. So just keep that in mind.
To let everyone, okay, to give us enough time to cover all three presentations. Okay, thank you. So thank you so much. It's really exciting to see the formative work leading into the implementation study, and really looking forward to seeing the results of that and how we can try and make